So good afternoon. How many of you used to be scared of needles? I know I used to be. I used to be so afraid every time I went to the doctors because of the possibility of getting a shot or maybe getting my blood drawn. And this is such a common problem in Nigeria.
Whether it be misinformation, uncertainty, or a general fear of needles, a lot of people are reluctant to go to hospitals or labs to get tested for typhoid fever. This prevents them from receiving the proper treatment.
But before we can delve into this, we need to talk about why it is so important for people to get blood samples such as these, and how that is important for the diagnosis and treatment of typhoid fever.
My name is Diana.
My name is Maya.
My name is Zaria.
I'm Lucas.
I'm Daniel.
And I'm Jerry.
So typhoid fever is an infectious disease caused by the bacterium Salmonella typhi. It collects and transfers because of lack of sanitary procedures. Throughout the world, there are 11 to 12 million cases per year, which results in 200,000 deaths per year. Typhoid fever is an important health issue which makes humans the main host and continues to affect the lives of developing countries. The fever is more common in children ages 5 through 19, however.
There are two ways to diagnose typhoid fever. The first one is a blood culture test, and the second one is a rapid diagnostic. So the first one, the blood culture, is usually more accurate. However, there is a harder way to test it because of the contamination that can happen. So with the rapid diagnostic test, it is more commonly used most of the time. However, it is harder to detect typhoid fever because of the low sensitivity of the test.
An accurate diagnosis is very important for whenever you're dealing with any disease, but also typhoid fever. So first we need to understand what is an accurate diagnosis. That means identifying a case of typhoid fever whenever the disease is still there, and not identifying one when there is none there, obviously. So this means no false positives, no false negatives. There are many main attributes of a diagnosis of typhoid fever that a doctor can use. One of them is a relevant patient history, relevant symptoms that the doctor can notice, and a blood culture. As we've already talked about, a blood culture is the most definitive way and the gold standard for diagnosing a case of typhoid fever. This is because once you take the blood sample out and culture it, you can very easily see whether or not the bacteria is present in the patient's blood. Another way you can test for typhoid fever is the Whittle agglutination test. This is, however, less accurate and less widely used because of some inaccuracies that go along with it. Therefore, we still mainly use the blood culture as the most definitive version of the diagnosis. How you perform a Whittle agglutination test is you take a blood sample and you insert Salmonella antibodies into it. Salmonella antigens into it and see whether or not antibodies will agglutinate to the antigens inserted. If so, then you probably have a case of typhoid fever. Patient-centered care is something else that's very important. We want proper care and no incorrect diagnoses because that can lead to results that could be even worse than the disease once you administer a treatment that is meant for something else. We want the treatment to be fast and certain. That means the patient will not be in any mental distress while they're waiting for results that could be wrong even. Because we believe that mental and physical well-being are just as important.
Patients seeking diagnosis and treatment for typhoid fever should look for their closest secondary and tertiary health facilities. Their primary health facilities may not have the correct equipment to correctly perform blood culture tests because they need microscopes, and those are quite expensive to have in every single village. And when the most common time that patients come in to get diagnosed and treated is during the second week or second stage when the abdominal symptoms set in and it's more serious. Another big issue is actually getting to the facilities. A lot of patients find this difficult, whether it's because it's too costly, it's too far away, and in some parts of Bauchi, it's just unsafe to travel. So this causes negative repercussions because these patients are waiting until the illness gets too severe, and that can lead to permanent health effects if they do not get their proper treatment.
The treatment for typhoid fever is mainly antibiotics prescribed by a medical professional. Antibiotics are the most medically proven and most efficient way to treat a case of typhoid fever. There are many types of antibiotics such as Ciprotab, chloroampicillin, and ampicillin. The reason why there are this many antibiotics is because of something called antibiotic resistance. There are many different strains of the bacteria, and some of them are resistant to many different types of antibiotics. This means if one doesn't work, we have to try many other different ones, and that's why we have so many available. The reason why these antibiotics are so effective at targeting these bacteria is because they are chemically proven to do so, which is why they must be used. There are some other treatments that people can use at home, such as a herbal treatment, which consists of blending together Lipton tea, lime oranges, pineapple, mangoes, and similar products. And people who use this in Nigeria claim that it helps cleanse their system. However, it is important to remember that the most important thing is to always go to the hospital and get antibiotics. Those are the most effective treatment.
So for our workshops, we have 3 activities prepared, and all of them are for the purpose to break the stigma that drawing blood is unsafe and to educate the people of Bauchi, Nigeria, the benefits. So for the first activity, we have a tank demo, which basically demonstrates the process of diagnosis and treatment through the use of fish tank and small Orbeez balls. And the second activity we have is a step-by-step manual for healthcare workers to teach them how to properly proceed with the blood culture test and to perform. And the third we have is a comic strip, which highlights and displays the overall process of a treatment. So first, as I said, we have the Tank and Orbeez workshop. So for those of you who don't know what an Orbeez is, it's like a small jelly ball. Before it's like submerged in water, it's the size of a BB ball. When you submerge it in water, it grows up to the size of a marble. And basically, we will have a table set up. There's going to be a fish tank, a 2-gallon fish tank, and we're going to have red Orbeez balls grown already and going to be placed inside. We're also going to have clear, transparent Orbeez balls placed inside, but in smaller portions. The red Orbeez balls will represent the red blood cells in a person's body, and the transparent Orbeez balls will represent the Salmonella typhi. We're also going to have a green backdrop behind the fish tank to help people visualize and see the clear, transparent Orbeez balls better. So for the blood culture demo, we're going to have a transparent bowl. We're going to take the scoop out of the fish tank and we're going to set it aside. That's how much blood we're going to need for the blood culture test. And also, we're going to have a reversible marker before we take the scoop. We're going to mark the level of the blood in the fish tank, and after we take the scoop, we're going to make another mark. Since there's so many Orbeez balls in there, once we take the blood out, the level won't drop that much, which will further demonstrate and tell the people of Bauchi, Nigeria that it's really safe and it doesn't affect you a lot to do a blood culture test. And for the antibiotic demonstration, we're gonna take water, we're gonna pour it into the fish tank. Now when you pour the water into the fish tank, the clear transparent Orbeez balls will start to blend in with the water. So as the end result of adding all the water to the brim, the clear transparent Orbeez balls will no longer be visible, and you're only gonna be left with the red blood cells, or the red Orbeez balls. So this just further demonstrates that after adding the antibiotic, it was able to clear out and kill all the bacteria within the human's blood.
So our first handout is a flyer that has a brief explanation on the simplicity of the diagnosis and treatment process when you have typhoid fever. And this will be handed out to all the community members at our workshop to help them get an idea of where they need to go and how many healthcare facilities there are. There is a map with all the secondary and tertiary health facilities in Bauchi, Nigeria. And once again, this is just supposed to give patients just a general idea of how far they will need to travel or where they're going to have to go to get their treatment and diagnosis properly.
So this blood culture manual is a step-by-step that shows how to properly test and accurately test for typhoid fever. This manual is intended for healthcare workers and professionals, for anybody experiencing that work. And it's important to be calm and easy so you can understand and the patient can understand you as well. So this is what the manual would look like. It would be a laminated double-sided manual. It would be step-by-step, easy step-by-step procedures for the healthcare workers and professionals using it. You see clean and prepare, introduce and prepare, position arm, apply the tourniquet, massage the vein, all the way to discarding the used equipment properly.
As for our comic strip, the strip represents a patient, and she is being diagnosed with typhoid fever, and then the doctor helps her get the pills she needs, and at the end she completes her battle, and she's safe and healthy. This encourages everyone, doesn't matter the age, to be able to go to a doctor instead of just staying home and feeling ill, and yeah. So this is our comic strip. As you can see, she's in a doctor's office, and at the end she's in the pharmacy. She gets her pills, and she is all safe and sound, and her battle's completed. So it really just, the main purpose of it is just to encourage people to go to a doctor instead of just like feeling scared. This is our itemized budget. So our itemized budget includes the blood culture, the comic poster, and the mat flyer, which would, all three would be $29 each. And then the red Orbeez, the transparent Orbeez, the 2 gallons of, the 2-gallon fish tank, the erasable marker, the green backdrop, and the water, and the remaining balance would be $330, which will be donated to buy blood culture test kits. These are our resources. Thank you.